lower your cholesterol naturally? Well, cholesterol lowering is irrelevant to worry about it. And if you come across doctors, influencers, nutritionists, dietitians trying to lower your cholesterol levels, they are after your money, and they will put you on a tasteless diet because they don't know any better. Again, cholesterol is not your enemy. So let's be clear here, and let me break it down in specifics. What you need to worry about is your oxidized lipids, and your triglycerides over HDL should always be below 1. That's the only inflammatory signal you will have to worry about cholesterol, nothing else. So that said, what is a safe, inexpensive, non-prescription, convenient, and effective way to reduce oxidized levels and reduce heart disease risk? The answer is niacin, or known as vitamin B3. Now, niacin is a water-soluble B-complex vitamin. It is well known to reduce the harmful oxidized LDL and triglycerides levels in the bloodstream, since it is one of the best substances for elevating HDL. And anyone with an inherited lipoprotein small a, in which plasma cholesterol levels are very high, now niacin flush version was the only vitamin that was able to correct this issue with a high amount of niacin, reaching anywhere between 3 to 8 grams per day, then of course cycling off and lowering to 250 to 500 milligrams per day. As for the flush effect, it is harmless blushing of the skin. It could be reduced by increasing the amount of vitamin C you take every 4 hours. And with a dose of 3 to 8 grams daily, did not affect or cause any abnormality to the liver. Just have to keep an eye on the homocysteine levels, which it should stay between 7 to 8 level. And the amazing thing about niacin, it does not decreases your cholesterol to dangerously low levels. It keep it at a normal balanced levels, which I cannot say about most other cholesterol lowering drugs. By treating symptoms for one disease, big pharmaceuticals drugs can cause you even more diseases. So if you want to give this a shot, here is the process. Start with 1000 milligrams of vitamin C and 100 milligrams of niacin 3 times a day, best after each meal. Now, after 3 to 4 days, niacin dose is increased to 250 milligrams 3 times a day. Continue increasing the dose every 3 to 4 days until the dose of 1000 milligrams of niacin and 1000 milligrams of vitamin C are taken 3 times a day. So there is a total of 3 grams of niacin and 3 grams of vitamin C. Take for 90 days straight and get a simple blood test by checking triglycerides, LDL levels, and homocysteine levels. I also have a link in my bio if you want to test at home. Now, if everything is stable, then continue for 6 months and retest to make sure stability is there. And you can cycle on and off every 6 weeks by taking a week off, or go on a 1000 milligrams a day for maintenance of niacin. Now, if levels of oxidized cholesterols are elevated, then continue increasing the dose until you find a suitable level of niacin your body requires.